Welcome to Chapter 1, The Meaning of Marketing. We're going to do a quick video lecture on most of the important learning objectives in this chapter. 5 learning objectives in this chapter. First one being define marketing and differentiate between marketing-driven and non-marketing-driven processes. Distinguish among marketing mix elements. Delineate between healthcare needs and wants. Understand dimensions of the environment that have an impact on marketing strategy, and appreciate the ongoing restructuring of the healthcare industry. First learning objective, looking at marketing and what marketing is. It is a consumer-focused discipline that the American Marketing Association defines as the process of planning and executing the conception, pricing, promotion, and distribution of ideas, goods, and services to create exchanges that satisfy individual organizations. In healthcare, the consumer can be different stakeholders. Typically, we're talking about patients or physicians. Even you could be a stakeholder. There are 3 prerequisites for marketing, which includes the establishment of a need between 2 parties. Second is the ability for one party to meet the need of another party. And a third, there must be a means to communicate. So who does the marketing? Marketing is done by individuals and organizations. They both conduct it for-profit and not-for-profit organizations. Marketing mix elements. Marketing mix is the vehicle that an organization uses to gain the desired level of sales. It contains 4 variables, starting with the letter P. First is the product, which includes goods, services, or ideas that are offered. Price, what the consumer is willing to pay. Place, the manner in which goods or services are distributed. And promotion, the way of informing the marketplace has developed a response to meeting the needs. Needs versus wants in healthcare. Healthcare professional responsibility demands treatment of needs. Is the patient really looking for a need, or is the patient looking for a want? And it doesn't necessarily have to be a patient. It could be another stakeholder, such as a physician. A patient may want a specific medication brand, but what they really need may be the active ingredient that's within the medication. These are things that we have to differentiate to make these decisions between wants and needs. When I worked in healthcare acquisition, I regularly came across physicians wanting a specific purchase of a new type of technology. One of the things I would have to do is analyze, is this a want by the physician or is this a need by the physician? One of the things I would ask is, would this new equipment improve the quality of care? Would we be able to recover the long-term costs, and how long would that take? And would this improve access to care for the patient? These are some of the things that would help me differentiate between a want and a need. Pause the video for a moment and think about different healthcare consumer needs and other healthcare consumer wants. Can you think of some that fit within each of these categories? Needs versus wants in healthcare must identify who is the customer. What is their dilemma in order to uncover needs and wants? We really need to understand what the patient or the physician or whoever the consumer is and what their dilemma is and whether it is a need or a want. We see in this graph potential markets for healthcare organizations, in this case a hospital. There are many different reaches that a hospital may market to, one of them being a community for prevention programs. It could be schools for sports medicine. It could be judges for rehabilitation programs, or maybe government agencies for grants. The evolution of marketing. We had a production era which focused on high quality production, assuming that people would buy due to health quality. There was a sales era generating volume, getting as many patients in the door as possible. And then a marketing era, satisfying needs and wants based on a patient focus. Marketing concept culture era, the customer orientation, sufficient understanding to target buyers, and create superior value continuously. Competitor orientation, recognizing strengths and weaknesses. Interfunctional orientation, coordinating and deploying company resources to create value. Long-term focus, continuously search for ways to add volume with business investments. Profitability, earning revenues to cover long-term expenses. Environmental forces affecting market and external forces. Greater role of transparency of prices due to consumers' desire for this information and aid in decision-making. Today we are in an era of information being disseminated to the patients, and patients are becoming more informed informed buyers of healthcare services. Most healthcare organizations are non-market driven. Their focus becomes more apparent with their long-range planning processes, including their strategic planning process. The market-driven process, outside and inside flow, market research at 2 points. This is where market and non-market driven differ. The 2 points are pre-testing and customer-driven differential advantage. Pre-testing new products, very difficult in healthcare environment due to the cost and the training of employees and new technology. When I worked as a surgical tech in cardiothoracic surgery, we did this on a regular basis. We would have suppliers come in and bring in new technology, which we would try out during surgery on patients to see if it improved the process. If it did improve the process and it found to be cost effective, we would typically adopt this new technology. Customer-driven differential advantage by providing incremental benefits of the product relative to the competing products that are important to the buyer. The strategic marketing process, stakeholders. Stakeholders are any group which the company wants to develop a relationship. Many times these are patients or physicians or others. The environment are some controllable and some are not. Some of the uncontrollable areas of the environment include regulatory, which could be legal forces, social forces such as demographic and cultural trends. Technological advances are constant within the healthcare industry, income distribution and interest rates, other organizations and individuals within the market. Society, being able to make ethical decisions while remaining competitive. The target market is a group of consumers whom the organization wishes to attract. Here we see an exhibit the broader societal market represents all the individual groups, businesses, and other entities that affect or related to or derive benefit from the healthcare organization. Organizing for marketing. Product-oriented organization, our service lines are becoming more common. There's 3 variations that exist. One is a matrix structure, where an individual has overall responsibility for setting the broad strategic direction for the service line. There's also direct line structures, where an individual has operating responsibility and accountability for clinical departments, and also clinical co-management structures, where hospital contracts with a group of physicians to provide daily management for inpatient or outpatient components. Organizational marketing success requirements include pressure to be market-oriented, capacity to be market-oriented, a clear shared vision of the market, action plan to respond to market, and clinical microsystem approach. Here these concepts are described in Figure 1-8, prerequisites for marketing. First one, the pressure to be market-oriented. This is a shared view that is accepted throughout the organization concerning the need for improved marketing program. Capacity to be market-oriented. Organization must have enough trained and experienced staff members who are devoted to improving the organization's marketing effort. They must have a clear, unified vision of the market and actionable first steps. A detailed marketing plan that includes necessary strategies and tactics, including the 4 Ps. You will be doing a marketing plan within this course later on. The changing healthcare marketplace. Traditional industry structure. The primary focus was on physicians. Get the physicians to bring the patients in the door and focus on the community at large. This has been evolving over time, where the focus now is more on corporations, managed care organizations, and a larger community focus. One of the things that come out of the Affordable Care Act was a greater expansion of accountable care organizations. This is the implementation of organized processes for improving quality and controlling costs. The accountable care organizations are held accountable for care results and costs associated with the outcomes. Figure 1-12 shows the paradigm shift in the accountable care organization environment, going away from volume and focusing more on population health. Of course, this paradigm shift has major challenges for marketing programs, which need to be taken into consideration. In summary, marketing is a process that involves planning and execution of the 4 Ps. Effective marketing for healthcare organizations involves recognition of multiple consumers or markets that often have a diverse array of needs and wants. A non-market-based approach to planning is one which the conception of the service begins internally. Marketing-based planning is an external to internal process. The strategic marketing process must consider the broad macro environment, stakeholders, environmental factors, and society at large. Healthcare marketing marketing planning requires identification of the target market, may differ from organizations' present customer base. Product-oriented organization services are managed as separate strategic business units or profit centers. Market-oriented organizations focus on major markets or consumer groups. 4 prerequisites to marketing success: pressure, capacity, vision, actionable steps. Shift the marketing paradigm from transactional focus to customer retention. Evolution of structure. 3 main consumers of healthcare industry: corporations, managed care organizations, consumers, and also accountable healthcare organizations.